It's another one in the gluten-free for the family series. And research has shown lately that there may be an effect on developing celiac disease and breastfeeding at certain periods in an infant's life, and that there may be a critical period to develop celiac disease. Now, there's not tons of research, but there is a good deal of it, so I'm going to read kind of some findings I found. New findings suggest that early introduction of solid foods may lead to gluten intolerance. In England, the incidence of celiac disease showed considerable decline in the 1970s because doctors recommended to avoid introducing cereals to diets and avoid the introduction of gluten into children younger than 4 months of age. And then a new 10-year study evaluated the age at first introduction of gluten-containing foods. And they assessed 1,500 children between the ages of 3 and 7 months who were at risk for celiac disease or type 1 diabetes. The results of the study showed that of 51 children who developed the celiac disease autoimmunity, those who were exposed to gluten in the first 3 months of their lives had a 5-fold increased risk of celiac than those children who were exposed to gluten at 4 to 6 months of age. Moreover, children who ingested gluten for the first time at 7 months of age or after showed an increased hazard ratio compared to children who had the gluten introduced in that 4 to 6 month of age window. The results of this study basically are confirming that there is most likely a critical period to introduce gluten into a diet of an infant. Also, in England, there was a meta-analysis done, and it had strong evidence that children who were still breastfeeding at the time that gluten was introduced to their diets had a 52% reduction risk of developing celiac disease, which I found that really, really interesting because I would never have put that connection together myself. And these findings conclude that breastfeeding during the time when gluten is introduced to the diet can prevent many, if not most, cases of symptomatic celiac disease. Additionally, Swedish observations showed that children that were breastfed at first gluten exposure exhibited a lower risk of developing celiac than children who were formula fed. The amount of gluten introduced to the diet didn't matter, it didn't make a difference. Even if the amount of gluten was high, the risk was still decreased if the child was breastfeeding. And so basically, in essence, these studies are saying there's a window, which is basically you need to do it between no younger than 4 months and basically no older than 6 to 7 months. And introduce gluten slowly, small amounts when your child is still nursing. So I thought that was interesting. Hope this is something for you guys to think about. As always, it's from Have Not to Have and gluten-free dining. Thank you so much for watching.